I'm Steve Edwards. I serve as President and CEO of CoxHealth. I'm based here in Springfield, Missouri. I want to give an update to our community about the recent situation associated with COVID-19 and our response and our community-wide response to that. When asked as a CEO of this organization, how do I think we're prepared to deal with it, I'll tell you we have 12,500 employees who are prepared, trained, and ready. They go each day prepared for a moment like this, and this is that moment. When I look at our position in the Midwest, I realize that we have the luxury and benefit of time. We've had our Incident Command Center set up for 3 weeks now, with section heads focused on logistics and operations and coordination and looking at various scenarios. We're focused on looking at important things like PPEs, and that's our personal protective equipment. We have a current inventory of those that's sufficient, but we know there is a worldwide shortage of that. We also have a cache of extra PPEs that we stored away for times like this. Our current supply is about 25 days worth. We expect additional allotments to come in, but it's a reminder that we will win this fight by PPEs. There's not enough in this country, and so we must be very judicious about how we use them. We must guard them, and they are the difference in protecting our community. Social distancing is going to be very important to us, and at CoxHealth we're going to be more aggressive perhaps than other organizations because we know that it is the way that we can bend that curve at the rate of infection. I believe that it only works if we take the necessary measures before those measures seem necessary. That's the only way it really works, so we're going to be more aggressive. Some see this as a blizzard coming that will come and go, and it's more likely to be a winter. It'll be enduring, and we'll have to manage it, and we know that it'll put a lot of pressure on our staff, our families working together. The days will become long, and we'll need to support each other. I hope that when this is completed, that our efforts prevented what could have been a very high fatality rate because we know that that has been the circumstance in some countries. Springfield has become unified and Southwest Missouri has become unified, but we're going to come together and share what we have so that we can test patients not in our clinics but in a safer place in a drive-up mobile situation. We have a very strong community and we have very strong partners, and we must rally together in a unified fashion. And while some may think of COVID-19 as being just almost another variety of the flu, it is different. It's chiefly different in that it's a novel virus, meaning it's a brand new virus, and we don't understand it fully yet. And so as we're exploring it and understanding it, we're beginning to understand the risk better. That is why we must be more prepared to deal with it than a typical flu. It's also going to be additive to the flu. And so one of the things that's encouraging, if you can find any silver lining in this, is that the aggressive change in personal hygiene, how people are socially distancing themselves and how they're keeping themselves in better hand hygiene. That, in the end, will save lives both for COVID-19 and for the flu. CoxHealth has been around this community since Thanksgiving Day in 1906, and we have, with this community, weathered many, many storms, and this could be another one. And we're prepared to work with our community to be in a better position to bend the curve associated with the infection rate of COVID-19. I'm grateful for the 12,500 people in this organization that are committed to helping our community. We're protecting our friends, our family, and our loved ones, and we're going to protect each other.